introductions first. I mean, some of you know who I am, but for those of you that don't, you soon will, because after Easter I'll actually be doing my pharmacology teaching with you. My name's Dr Coffey, and I actually work obviously up here in the pharmacology department, and I run the 3-year science pharmacology course, which is the medical pharmacology course that's run in UHW parallel with the medicine course for well over 30 years. And one of the things that obviously pharmacology does is underpin medicine. And we've had a very, very healthy relationship with the pharmacologists that we train up, and also the pharmacology that we teach within the medicine course. And as you probably know from Professor Morgan, the Dean of the Medical School, there's a big emphasis now on having research-led medicine in terms of what you learn and what you apply. And it's really great to see that this society has actually come about, because that's exactly what we're after here. We're after actually having the clinicians of the future being involved in active research. And what I mean by that is that the vast majority of physicians that get churned out of medical schools in the UK, they are users of medical evidence, but they're not producers of medical evidence. And what we're trying to foster here, and what's great about this society, is that you are potentially, you're sowing the seeds for having a career that involves perhaps some aspect of medical research. And that could be anything from laboratory-based research to social sciences to socioeconomic research, you name it. That's what doctors can actually bring to the table. And I think it is vital that we do have a cohort of a new generation of doctors and physicians who are contributing to research. And what you will find as you go through your 5-year undergraduate program is that you'll have a chance to have a taste of research experience. But also, perhaps more importantly, in your postgraduate practice, in your clinical practice, there will be a requirement for you to undertake a period of research as part of your postgraduate training. Okay? And it is vital that you understand the basics of what systematic research is in terms of a high quality approach to undertaking the experiments themselves. But really what I'm going to chat to you about this evening is another sometimes overlooked aspect of the research agenda, and that's being able to communicate with research. And up until, I've been here about 14 years, up until about 6 years ago, my background was purely cardiovascular research in terms of drug toxicology and cardiovascular pathology. And so, you know, my working day would be involved in working in the Heart Institute laboratories, doing shed loads of laboratory-based research, writing up those experiments, putting papers together, writing grants, research proposals, and then also going off and presenting my work at international conferences. And one thing that I learned from that experience of going pretty much all over the world to present stuff is, A, it's great fun to actually present your work, but also one of the slightly more worrying aspects is that I went to a number of research talks given by actually Nobel Prize winning scientists, and they were just the pits, absolutely the pits. And here's the thing, is that very often you might have a world-class medical researcher, but it's not worth a thing unless they can communicate that world-class research to a diverse audience. And when I talk about a diverse audience, it can be anything from making a pitch, making a research pitch for a grant, so you're trying to get some money out of somebody, or, in fact, assuaging the mob of people that don't understand what we're doing with your research. So you may be talking about your research to a lay audience. So there are some tips and tricks to enhancing your research presentations, and this is very much geared towards the kind of presentations where you're standing up in front of your work and defending it and presenting it, and in fact teaching people about what you're doing. And this is, I think, one of the things that researchers sometimes overlook, is that when you are doing this kind of presentation, even though it may be on a pure research subject, you're actually the educator. It's a teaching process, it's an education process. And I think if you get that, then your presentations are always better. So really, when we talk about the objectives of a good oral presentation, is you've got to really try and tick these boxes. You want to educate and inform the audience, particularly and specifically on whatever research topic you've been contributing to. Okay, and I'll come on to the nature of the audience in a second, because that is a very important determining factor on how you pitch and what level you pitch your talk at. And really, I think this is top of the tree. If you can, at the end of the talk or end of presentation, go home thinking, actually, those guys learned something today, and they've been educated, and they've been informed, and they've assimilated that information on a topic maybe they didn't know much about, then my job is done. So educating and informing, top of the tree. But you've also got to make sure that your audience comprehends what's going on. And this is a big criticism I would have of medics doing research in general, is that certainly in my research career, a big criticism is that medics like to hide behind jargon. And they hide behind jargon typically when they don't understand the subject themselves particularly well. So they'll bamboozle people with all the kind of technical wizardry jargon, and it's all bluster, and it's superficial, and it underlies or belies the fact that they don't actually understand the topic themselves so much. They try and hide behind this facade of technical jargon. And that doesn't work. So you need to make sure that however you present your work, the audience can actually comprehend and understand it. And really a good yardstick for whether your presentation has actually ticked those boxes is the kind of criticism you get at the end. And if you get constructive criticism in your research, that's really useful, that's really helpful. And to be fair, most of the international research conferences I've ever gone on, the kind of questions, the kind of criticisms I've got have been constructive criticisms. They might not have liked the experiments or the research that I did, but they had suggested alternatives or improvements or enhancements that I might have wanted to consider. So it was all very constructive. The worst kind of feedback you can get is where somebody asks you a completely off-topic question, which kind of indicates they never understood what you were talking about in the first place. And I'll come on to that right at the end in terms of how you can handle questions in a research talk. But you do really want them to understand what's going on. So, there are a number of challenges that you need to think about when you are talking about your research. Now, I put my hand up here is that obviously the emphasis here is on presenting a piece of medical research that you've been involved in. And that can be any subject that you happen to be engaged in. But I'll be honest with you, a lot of these kind of communication skills are the classic transferable skills that all doctors need. Okay? Whether you're talking to expert scientists in a research field, or whether you're talking to patients or the family of patients about a particular procedure that you're managing your patient with. Those kind of communication skills come in really handy, and they can be the difference between having, for example, the patient on side with you, actually working with you, or putting their back up because they don't understand what's going on, they're frightened, they're defensive, because you haven't communicated what's going on effectively. Okay, so a lot of the stuff here, yeah, I'm talking about research, but actually what I would like you to do is to start thinking about applying these kind of skills within your undergraduate environment and certainly in the postgraduate environment too. Okay, certainly the classic example is grad round, or in fact ward round. When you're in the ward round and the boss is saying, okay, summarise patient X to me, you've got to actually nail it in a very short period of time with good communication skills so you don't get a hiding off your consultant. So you've got to get your message across. Okay, that's the main challenge. You've got to actually get what you want into the audience's psyche. And this is a really difficult one, keeping the audience's attention. If you're sat, you know what it's like, you sat in a lecture and the lecture theatre is hot, it's a boring subject, obviously not pharmacology because that's awesome, but you begin to drift off and maybe somebody texts you and you're tweeting and yeah, you just basically lose what's going on. Your audience drifts off and it's quite difficult to get people back once you do lose them. So one of the arts, and it is really an art, is a good oral presentation is to keep your audience's attention, engage them. Much more difficult than you think, and again with the new C21 curriculum, what we're trying to do with the new style of teaching is to make it a more engaging process, okay, to actually make sure that people aren't just being talked at, but they're actually contributing and proffering ideas, and that's certainly what we'll see within research talks. Research talks tend to be people saying, you know, here's my research, what do you think about it? Is there anything I can do to improve it? Would you have done this experiment? So it's quite an interactive experience. And that can, by default, help keep your audience's attention too. Also, what you're trying to do as a challenge is to demonstrate your expertise to somebody. And again, this comes back to the point that I was talking about, where if you hide behind a facade of superficiality because you don't really understand it yourself, you'll get called out. Okay? It's one thing that a research audience are very good at doing, and an audience of professionals are very good at doing, is seeing through those cracks if they know if you're bullshitting. Okay? So you need to be able to demonstrate your expertise, and you need to convey competence and confidence, but without crossing the line into being cocky, and without crossing the line into trying to pretend that you know more about the subject than you actually do. And the reason you need to do all these things is because ultimately you want to be memorable, but you want to be memorable for the right reasons. And again, I'd ask you to look and reflect on some of the lectures you've had whilst you've been here, and you know what it's like, is that you will have some lectures that are fantastic, and you come away from thinking, wow, I really, from that particular teaching session, that really clicked with me, I really remembered what was going on. I can actually, that really did work for me. And similarly, you will have sat through interminable lectures that, in a 50-minute slot will have 200 million slides, and it just doesn't work for you at all. So you will typically remember two types of lecture and two types of teaching sessions. You remember the really good stuff, and you'll also remember the really bad stuff. It's a bit like school. Okay, you remember the good teachers, and you remember the really bad teachers. So you want to be, when you're giving a presentation, you want to be memorable, but you want to be memorable for the right reasons. So, knowing your audience, that is absolutely critical. And this is interesting, and I put this slide up a little while back. I was doing some teaching for some GPs. Similar kind of setup. It was a slightly more research-oriented, slightly more cardiovascular research-orientated session, but we were talking about how to convey cardiovascular research topics in an understandable way. And I kind of put this schematic up to say, look, you need to be able to get a feel for your audience demographic, because your audience demographic actually dictates to you the level and the pitch of your technical explanations. And I put this up, and the GPs went bonkers, because the GPs, Doc, we should be up here. They were getting all like bent out of shape about it, and crying. And I'm saying that honestly, I've been doing this for a long time, and I can tell you that you can have physicians that, if they're undertaking active research themselves, are topic experts and certainly fall into this category. But in terms of, if you go into your bog standard GP and I say, okay, tell me how ACE inhibitor drugs work and tell me how angiotensin receptor blocker drugs work, the answer will be, well, we use them to lower high blood pressure. And I'll say, well, no, that's not actually answering my question. That's the clinical use and the therapeutic use. So tell me how they work. And they honestly can't tell me how they work. Okay? They just know that they lower blood pressure and they're really good at reducing hypertension. But what I'm talking about is the technical understanding, the molecular mechanisms of action, the therapeutics, the toxicology, the holistic, all the really technical stuff only comes when you are actively engaged in that particular topic. And so it's really important that if you are talking to an audience who are all working on the same thing, then you need to make sure that your presentation is populated with stuff that isn't patronising and doesn't retread over ground that they're already familiar with. But you've got to understand that this spectrum exists, and certainly when you're giving presentations, you may actually have quite a diverse mix of people in there. You may have students, but those students may either be science students, nursing students, dentistry students, who knows, So there's a whole spectrum of people, and it is quite important to get a feel for that demographic, because that, if you know what the demographic is, should and will dictate how much detail you go into, because what you're trying to do here by identifying the demographic is making whatever topic you're talking about to whatever demographic as accessible as possible, okay, as meaningful as possible. So you're deconstructing complex topics for a lay audience. And when I talk about a lay audience, that's typically Joe Public, or the patient, or in fact the patient's family. And why is that really important? Well, I tell you, if you walk down St Mary Street in Cardiff and you ask somebody at random to identify where their kidneys are, most of them will just get it completely wrong. If you ask them what a cell is, they won't know either. So all the kind of stuff you take for granted as medical students who've done medical science as well, all that stuff you take for granted because you are mixing with an environment and a demographic of people that know all this stuff. You know as students the basics, you're dealing with academics and physicians and scientists who are really hopefully quite clued up. So there's a lot of stuff you would take for granted that the general public really doesn't know. Okay, so you have to remember that if you're talking to a lay audience, you really do have to go to work in deconstructing complicated topics, or else they become defensive and you lose them. Okay, so this is worth remembering in terms of who you're talking to. So I guess we're making the assumption with this kind of presentation tonight, or what the topic is that you'll be talking to either doctors, scientists, or topic experts. So you can be pretty technical, pretty scientific, if you like, with your explanations. But that does still come with some caveats that I'll come on to when I talk about how you present complicated science concepts. And this is a really important thing to do. You've got to be able to manage the expectations. And there's 6 of one, half of us on the other here. There are 2 main sets of expectations. There are your expectations in terms of when you are putting your presentation together, are you actually going to be able to achieve what the brief is? So the brief may well be a research project supervisor, your boss, saying to you, okay, I want you to go off to San Diego, I want you to go to the Free Radical in Biology conference held every September, and I want you to present your data to the international audience, and you've got a 15-minute slot to do it. So that's the brief, if you like. And so you need to make sure that when you put your presentation together, when you're populating the presentation, is it actually going to meet the expectations that you have for it, and potentially your boss has, or the research group has? Because you're going to be an advert not only for yourself in terms of your research credibility, your research potential, but you're also an advert for the research group you're working for, the establishment you're working for, etc., etc. So you're going out there with a badge on saying, this is me, this is what I'm doing, but you're an advert for that establishment too. So there are your expectations, and equally, different side of the same coin, there are audience expectations. And audience expectations are quite difficult to predict, other than to say that you really want to be satisfying them. You really want to be impressing them. What you don't want is for somebody to haul ass into a presentation and maybe have come from a completely different country and then to feel like they have wasted their time. I went to a conference in Lyon back in September. Fantastic city, fantastic food. It was just fantastic. But one thing that wasn't fantastic was the conference I went to. And it was the pits. It was garbage. It was supposed to be on medical education research, and it was just appalling. It was genuinely a waste of my time. It was a waste of my air ticket. The only thing that made it worthwhile for me was actually the food and the ambience. But that's not really a good reason for going to a particular place. So the audience has high expectations, and they don't want to feel shortchanged by having to sit through 10, 15, 20 an hour's worth of talk if they don't get it and they're getting bored, they can't see the point of it. So there are 2 sets of expectations that you need to balance and try and manage those sets of expectations. Now, here's the key thing that a lot of people, particularly students, particularly medical students, balk at. You will have, when you give a research talk, whether you are doing it as an undergraduate student whilst you're with us, or while you're doing your postgraduate training and doing a period of research, you will be given a time slot to give a research talk. And it's not uncommon to have, for example, a 10-minute time slot. Now, why am I showing this? If, for example, you have a 10-minute time slot, this is the maximum number of slides you should ever be having. Okay? Now, a lot of students sort of have a bit of a knee-jerk reaction to that, and they think, bloody hell, I've only got 10 minutes to talk about this huge topic that I'm being expected to talk about. 10 minutes, 10 minutes, 10 minutes, I've got to cram as much in as possible in 10 minutes. And this is, again, a criticism of medics in general. Medics in general have the philosophy, more means more. And in fact, when it comes to short periods of time, when you have a short window to actually make a presentation, this is the golden rule. Less is more, okay? I don't tend to do a lot of 10-minute talks these days. Occasionally I do. I did one last year, and it was to some consultant cardiologists. And I had a 10-minute slot, and I had 4 slides. And 2 of them, one was the title, one was the summary. Okay? So very much less is more. And I'll come on to what you put in those slides in a minute, okay? Because there are some tricks and some tips to help you get away with a reduced number. There are your title slide, perhaps your summary slide, your acknowledgement slide. But this philosophy means that at the very least you've got a bit of time to talk about the content of the slides. What you don't want is to be rattling through loads and loads and loads of data slides, particularly if those data slides are really quite complicated and actually take the audience quite a while to assimilate. And I'll come on to that in a sec as well. But this, I think, is the most important lesson to learn, is that if you have a short or 10-minute slot to do your presentation, keep your slide number. Not this year, I should mention, but last year it's intercalated. And even though we kind of told the students roughly the same, you know, a 10-minute talk here, and we gave them some kind of pointers and directions about how to enhance their performance, there were still some students, even with a 10-minute slot, who came in with 20 slides, 22 slides. And you know, 22 slides for a 10-minute talk, when you do the numbers, when you actually work out how quickly you're hitting that slide advance button, it's like a machine gun. So this, I think, is the most important lesson that I certainly learned when I was starting, is that I had this philosophy, is that, you know, I thought, my God, I've got 10 minutes to do this. I can never get across all the information I need to in 10 minutes. I must cram as much in as possible. And of course, it's a disaster. Okay, so you can apply this rule in a kind of a multiplier. So obviously, however much time you've got to give your talk over 10 minutes, just apply this rule. Okay, for every 10 minutes, you've got 5 content slides. Okay, and if you work to that rule, you will be part of the way towards a really successful talk, okay? And like I said, I know that you know this to be true because you only have to reflect on some of the lectures you had so far in medical school, okay? So you know what it's like to be on the receiving end of 1,000,001 slides that you can't assimilate in time. So this is absolutely crucial. The reason I spend a little bit of time talking about this is that if you get this bit right, you're actually halfway there to doing a good presentation. So, some general points now about how to enhance the way that your talk comes across. And again, this is something that can be a little bit overlooked. I think people are so wound up and so het up about making sure that the data, the experiments are actually all locked down and ready to go. Then obviously, yeah, when you're putting your presentation together, a lot of your time will actually be sifting through the experiments that you've done, the research that you've done, and editing what you think is actually appropriate to put in your talk. So obviously there's quite a significant amount of time done with that, but it can all be for nothing if you actually make a balls of the presentation in terms of how it comes across. And one of the key things, one of the absolutely key things, is how you communicate orally. Because you've got a kind of a two-way street here in terms of how your presentation is viewed. There are the visual elements of it, whatever's up on the screen, but also what you're doing as a presenter is that you're walking somebody through, you're walking the audience through whatever you're talking about up on the screen. So you have to have a clear oral presence. Okay, so vocal projection is a very, very underused skill. Okay, we do talk to you about communication skills in medicine, but it tends to be the communication skills we tend to emphasise to you are along the lines of how you talk to a patient in a small room. And that's not the same as how you actually communicate to really quite a large audience. Now, it doesn't matter whether it's 10 or 12 students sat in a small lecture theatre, or whether you go to the American Heart Association and you're talking to 500 physicians and scientists all in a massive auditorium, you've got to actually nail this thing of vocal projection. Vocal projection doesn't mean shouting. A lot of people think that, wow, you walk in here and you think, this is, you know, when I'm teaching all of you, teaching a whole year, there can be nigh on 400 students in here. And you think, wow, how are they all going to hear me? Now, first off, most big venues these days are pretty modern and they do have a mic system, so you don't have to shout. But to be honest with you, I've never used a mic system. And that's partly because I just trained my voice to be able to project. And it doesn't mean shouting, but it does mean actually considering your mouth to be the loudspeaker. Okay? And if your mouth is the loudspeaker, you need to make sure your loudspeaker is pointing towards your target. Okay? What you don't want to do, and this sometimes happens, and again, it's a function of confidence in your speaking abilities, is actually just kind of mumble into the floor. Because if you're pointing at the floor, the loudspeaker is pointing at the floor too. Okay? And mumbling, again, it sends out the wrong message and you begin to lose your audience. Okay? So vocal projection means actually largely just speaking out to the audience. Okay? Coupled with a mic system, you don't have to shout. But don't fall into the trap of speaking softly and mumbling. And it's seen as weakness. And in many ways, you have to actually consider your audience to be like circling raptors. And they're waiting for a little sign of weakness. And how they respond to that sign of weakness is that they'll give you a grilling in the questions afterwards. Whereas if you're confident with the way that you are talking about what's up on the screen, the research that you've done, then that confidence can actually feed into how the audience perceives your approach to your research. If you are confident in talking about the experiments you've done and you're showing them up on the screen, you're less likely to get a grilling in the question settings because people are thinking, wow, they're really confident, they must really know what they're talking about. So vocal projection is absolutely key. And mumbling, I think, is perhaps one of the worst traits of a bad presentation. And one of the things about mumbling is that it will lose you your audience. And like I said, it's very difficult to get the audience back when you've lost them. So when I'm talking about mumbling, I'm talking about the need to enunciate and be clear and be confident with what you're talking about. Now, particularly with medical research, particularly with medicine, there are an awful lot of technical words, okay? And a key to a good presentation is be able to clearly pronounce all those technical words, particularly things like drug names. Okay, it's obviously a bit of a hobby horse for me because I'm a pharmacologist, but the number of times I hear presentations where they can't really remember what the drug is, and so they start off saying that the cardiovascular drug they're going to use to treat this arrhythmia is and they kind of just lose it. So they kind of forget what they're talking about, and they mumble the drug because they're really not sure how to pronounce it. So, mumbling those difficult words, that's it, it's game over for you. And when I was doing my research, I worked on this compound, hydroperoxyicosanoic tetraenoic acid, and that's a word that you can't say if you've had more than a couple of pints, because if you try and rush that, and you make a balls of it, it sounds like you've had a stroke, okay? So the way that you overcome pronouncing these words, these technical words, really is to what I did, which was chunk it. And that means you break down those incredibly long and difficult to pronounce words into those phonemes, okay? So when you have a particularly difficult word that you want to pronounce, you break it down into its constituent syllables, okay? So you practice. And most of a good presentation is a function of practice, but you practice talking and saying these particular chunks until you can put them all together. So hydroperoxyicosanoic tetraenoic acid can be broken down into the phonemes and syllables, and you just literally practice and practice and practice until you can put them all together. And that, although it sounds really stupid, really does work in those. Works with drug names, works with technical procedures, it works with anatomical structure, you name it. Anything that has a long technical balance to it can be broken down into chunks, and all you then have to do is practice those chunks until you're at a point where you can put it all together. And one of the key things about pronouncing technical words, and when we're talking, the reason I'm banging on about this is because when you are doing your research talks, you will inevitably be talking about technical things, either medical technicalities or, in fact, more likely, to be experimental methodologies that may have a lot of technical components to them. So it is absolutely vital that you nail it in terms of clarity to the audience, because again, what you're trying to do with the audience is make sure the audience understands what you're doing from a research perspective. So if you're mumbling drug names and you can't pronounce hydroperoxyalkoxotetrenoic acid or whatever, then the audience are thinking, well, they can't pronounce it, I certainly don't know what the hell this is, so again, you lose the audience. And there's a trick actually to this whole area of enunciation and clarity, and that's pace and tone. And the key thing about your tone is that, and this is the best trick that I actually learned from the Jedi Master that taught me, is that if you lower the tone of your voice, that really does help your enunciation. It helps your pronouncement of a particular technical word. Now, more importantly, not only does lowering the tone of your voice help you pronounce those technical words, it physically slows you down. When you lower the tone of your voice, air is passing over your vocal cords slower. And the reason this is a big deal is that when you're giving talks for the first time, if you're not used to giving talks, your heart's going like the clappers, you've got that big adrenaline rush, you're breathing really quickly. And I've heard it, particularly with students who aren't used to giving talks, is that their voices get higher and higher and higher, and they speak faster and faster and faster, and then only bats can actually hear them because they go ultrasonic. Because they're squeaking, because they're so wound up, they're so het up. Now, lowering the tone of your voice actually is a really good way of pacing your talk as well, because it physically slows you down. If you are slowed down, it makes the pronouncement and the enunciation of all these words a lot easier. It physically slows you down. It's putting the brakes on the stress. Now, when I say lowering the tone of your voice, I don't mean that as females you have to sound like Darth Vader, okay? All I'm talking about in terms of the lowering of the tone of your voice is that anybody that knows me will know that the way that I lecture in a group environment is not my conversational voice, okay? My voice when I'm talking to you now is a lot lower than my conversational voice. If I'm talking to colleagues in a room or patients or whatever, I will not be using this tone of voice. This tone of voice helps me give my presentations because it's slightly lower than normal and it's slowing me up. It allows me to say hydroperoxyalkoxotetrenoic acid. Okay, so that's the best tip that I was ever given by somebody, is that if you lower the tone of your voice, that can really help with the pacing. It diffuses some of the stress. Because I know what it's like to get stressed before a talk. It's a big deal, you're getting wound up, you've got that adrenaline burst, your heart's going like the clappers, you're breathing rapidly. That all means that your oral communication skills can be sometimes compromised by that. So if you just practice lowering the tone of your voice a little bit, that will slow you up, and it will really, really make all the difference in the world to how you come across for you. Because remember what we're doing here? You are acting as the voiceover to whatever is up on the screen. Okay, and I'll elaborate on that a little bit more in a second. But pace and tone, if you can nail that, again, you're well on your way to doing a good talk. Now, any of you that have done presentations already will know this, particularly if I was in the audience. If you read from a script, if you have lecture notes, if you have crib notes, and you are doing your presentation, reading from notes, forget about it. You will absolutely kill your presentation stone dead. There is nothing worse than the defensive firewall that people use of standing next to the screen and reading from extensive notes. Okay? There's an awful lot of psychology when it comes to doing oral presentations, and again, your audience is very good at picking up on that psychology. If you read from your notes, if you are so het up and stressed out about your presentation, the only way that you can remember what to say as you're shaking there is to read from your notes, it comes across as amateur night. Okay? It comes across as somebody that really has no confidence in their own abilities. And it's actually quite rude, because again, the psychology is you're hiding behind the notes. You're hiding from the audience behind your notes, because it means you don't have to look at them. You just hide there. And it's an odd thing. A lot of people want the security blanket of having their notes with them. But if you read from your notes, and I'm talking about anything, not just a research tool, but if you're doing a ward round or you're doing a grand round, I've seen it, I saw it in a grand round recently. Some guys just going through the patient's notes file, extensive file, talking about what was going on. And although there was nothing wrong with the content of what they were talking about, the audience didn't give a monkey's, because this guy was just sort of looking at the wall and going through the notes and sort of advancing the slides each time. It was just rude. And so you want to come across as professional, you want to come across as exuding expertise, certainly expertise in the research field that you're actually presenting. So this is an absolute no-no. If you have your notes and you're seen to be reading from it, nah, forget about it. In fact, what you need to do is practice your talk so much that in fact the only prompt for you to describe what's on screen is the slide itself. And if you have a brain freeze, then you reset yourself by looking up on screen and using what's on the slide as the trigger to restart the flow. Okay, what you don't do is start to leaf through all your notes and think, okay, that's slide 5, oh, hang on a sec, oh, sorry, oh God. And I see it pretty much every week if I'm looking, certainly in student presentations. Now that's a function of experience and practice. But if you are seen to be reading from your notes, the circling raptors will come down and you'll get a ton of bricks in the question settings. Okay, so my concession to this is that if you really do need that security blanket of notes to help you get through a talk, then okay, you can bring them, but you need to tuck them away. Okay, you need to have them tucked away subtly on the lectern, so people really can't see you leafing through them and reading from them in a rote style. So if you need them there just as a security blanket to say, they're there if I need them, if I do have a brain freeze, that's fine, as long as people don't see that they're there, as long as they don't see you actively reading from it, you can get away with it. But my top advice is, you should be able to practice your talk so many times that you're almost, not quite, you're almost sick of it. And what I mean by that is, when you practice your talk for the umpteenth time, it just becomes second nature that the slide is up there, yeah, you know what we need to talk about there, and therefore you don't get the brain freeze, okay? There's sometimes a little bit of a need to put a presentation together. You spend a lot of time putting the data figures together, the contents of the slide. And what sometimes happens is, you then think, right, done it, put it to bed, and then you leave it until a day or so before the presentation. Because you think, well, I put all the work in to put the data figures together, that's done and dusted, leave that, park it, and I'll do it on the day. That is a hiding to nothing, because if you don't practice it extensively beforehand, you'll come a cropper when it comes to actually giving the talk. You'll walk in, you'll see all the faces in the audience, and you will have a brain freeze. And because you haven't practiced it, you can't then use the slides as a prompt for you. Okay, so make sure that you don't have to use your notes. Now, obviously when you're putting your talk together, this can actually be quite useful, because effectively the way that I put a presentation together is that I put my slides together and I effectively write a script. I write a voiceover script for each of my slides. And then once I've got that script ready, I practice it to the point that when I'm talking about a slide, I don't need to refer to my script. Okay? So yeah, you do need a script when you're putting it together, you just don't use the script on the night. Okay? Another big vote loser. If you don't engage with your audience by looking at them, by talking to them, then you're going to lose them. It comes across again as amateurish, it comes across as rude, and I see this a lot with speakers who are not confident. And I would say that I'm not just talking about student speakers now, I'm talking about researchers researchers who are fantastic researchers, but they are bloody awful at giving talks. And they will do all the kind of bad body language stuff that really tells the audience that they'd rather not be there. They've kind of got the kind of tense, hunched physiology. They're staring at the wall, or they're staring at the floor, they're mumbling, they're not talking. And again, if you're not engaging with the audience, then they're going to switch off. They're going to think, well, you know, I could be at home watching TV, and I've come in here to just be not talked at by somebody who really obviously would rather be somewhere else. So the body language is really important. So make some eye contact. And the key thing here is about eye contact is you don't have to make specific eye contact with the particular people. And in fact, I wouldn't recommend that, because I can guarantee, particularly if you're doing student talks, is that if you are doing student talks and you make specific eye contact with an individual, maybe one of your mates, you can guarantee in the middle of a really important part of a talk, your mate will go, and then will completely uncouple you, and you'll make a mess of the next slide. So when I talk about eye contact, is you're looking generally out over the audience. Okay, I know quite a few people, their tip is, if they wear contact lenses when they're doing the talk, they take their contact lenses out so they can just see a kind of a blur parcel of being a doctor. And that extends to any kind of research or any kind of presentations you're doing. So one of the things that I see quite a bit of that always concerns me a little bit is the laid-back approach. Somebody will come in and, you know, this is I remember this is I went to a conference in, and really, really major piece of cardiovascular research had been presented. And the guy sort of wonders in wearing flip-flops. He's just clearly come off the beach, and he's sort of like, you know, he's got his sunglasses propped on his head, and it was a real shame because it just sent out the wrong body language. It sent out the thing that, hey, you'd rather be on the beach, wouldn't you? And it didn't work, and it was a real shame because it de-emphasised, it defocused his actual talk. Because his talk actually was pretty good, the research was pretty rock solid, but people were looking at him and thinking, nah, surf bum, you know, why does he come in here? And it sends out the wrong message. And again, a lot of, you know, one of the threads here of this talk this evening is that there's an awful lot of psychology, an awful lot of body language involved in a good presentation. And dressing the part is actually part of the battle. And if you dress smart casual, that's all we're after. We're not after, you know, top hat and tails and ball gowns, but we're after you presenting an air of professionalism. Because you will either be doctors in training, as you are now, or you will be doctors. Okay, so the flip-flops t-shirt and, you know, free the weed t-shirt, that doesn't work. Okay, so you have to play the game in that respect. Now, one thing that I'm particularly bad about is I like to walk around when I'm giving a talk. Okay, I find it very, very difficult to stand still and stand next to a lectern. Any of the students that record me on their iPhones these days get really pissed off because they'll put the iPhone there to record my lecture, and I'll be walking over here talking about this, that and the other. So it is quite difficult for some people to stay still. It's something difficult for me to stay still. And it's not too much of a problem as long as you sort of hover around the kind of target area. But you do need to sort of make sure that your physical mannerisms, again, don't give away how nervous you may actually be. And again, you know, over the years I've seen a whole range of body language of people just physically shaking because they're so wound up and so stressed about giving a talk. Now that upsets me because talks and presentations, oral presentations, should be fun. They should be an opportunity for you to show off and actually say, look, this is the research I'm doing. I mean, isn't it great? And you know, I'm getting a chance to talk to you about it. Isn't that great? And so they should be an opportunity for you to enjoy yourselves. And really, the good talks are clearly done by people who do enjoy giving talks, who do enjoy giving presentations. So you need to send out the right vibes. Certainly dressing smart casual sends out the right message, and certainly trying not to fidget so much that the audience is thinking, please, just go and take a dump and then come back in and everything will be fine. So you've got to play the game. Now then, the latter half of this presentation really is along the lines of how to maximise the visual impact of the research that you're talking about. So let's start with the classics of how not to put a slide together. And again, one of the issues here is that researchers, medics, tend to be good researchers and good medics, but they don't tend to be particularly au fait with what is a good context, visual context with which to frame their work. And part of the problem can be laid at the door of PowerPoint, because as PowerPoints become more sophisticated, a bit more whiz-bang, there are more things you can do with PowerPoint, more buttons you can press, and people think, wow, great, this is going to look great. And when you're doing something on your laptop, it actually looks quite different from the way that it's presented up here. Now, I've always been quite cautious about this, because I'm colourblind. And it's very difficult for me to make sure that I get the right colour balance. I'm literally the person that goes into the shop and I'll buy a bright red pair of trousers. My wife will say, why have you bought those red trousers? And I'll say, but they're dark brown trousers, aren't they? And they go, no. So I've always been a bit twitchy about this because I'm colourblind. But I see it an awful lot in that people use a really bad choice of background colour or background font. They change fonts within different slides. I went to a talk a couple of days ago where every single slide had a different font on it, and it just didn't work. It really jarred, and again, it detracted, it defocused from the content of the research, because every single slide had a different colour, a different font. It just didn't work. It didn't work at all. And there were plenty of slides in the talk that I went to a few days ago that were red text on a kind of brown background. I literally couldn't read them. Okay, I really can't have, I have trouble distinguishing reds and greens, and a lot of the audience will. Okay, being red-green colourblind is incredibly common. Okay, so you do need to make those kind of considerations when you are thinking about how you're going to frame the content of your talk. So what this bit isn't about is how you put your data together. Okay, that is a sort of a separate evening, potentially, where somebody will come along and tell you, okay, this is how you actually systematically go through the data and edit it into a format that's ready to put on your presentation. So I'm not going to talk to you about that. I'm talking to you about how you maximise the impact of that data once you've got it to the point that you want to sling it up into a slide. So you need to be quite careful. So when we talk about fonts and when we talk about sizes, you know that thing about less slides? If you've only got a 10-minute slot and you only have, say, 5 data slides, less slides does not mean cramming tons and tons of text and tons of things into those few slides, thinking, well, I've only got 5 slides, I'm going to hoof a load of information in there. Now, there is a little trick around that, which I'll tell you about in a moment. But a good slide is clear and there's not too much information up there. Or rather, there is enough information that you can talk the audience through. So you need to pick a clear and large font for your title. Normally we embolden that just so people know that it's the kind of the headline. And you don't put too much text on per slide, and certainly what's up there is big enough for the audience to read. And critically, you use a font that is nice and clear. Okay? And these are my weapons of choice over the years. At the moment, I'm particularly liking Calibri, but in the past, Arial, Verdana, Helvetica, anything that is clear. You don't want any of these kind of fancy, ridiculous slides that are actually, you might think, wow, these look really good on my laptop, but actually when you blow them up to this size, you can't read them at all. So keep things clear and make sure that they're big enough and there's not too much stuff up there to overwhelm the audience. Because as I said, if you overwhelm the audience, here's the thing. The knee-jerk reaction to saying, okay, well, I've only got 5 data slides, and you just said, I can't cram loads of information in there. Remember, your slide is going to be up there long enough for you to talk about some of the stuff that might not necessarily be up there on screen. Okay, so it's a two-way street. There's visual information for the audience to assimilate, but you're talking about it too. Okay, so you don't have to necessarily overload your slide. And there are some tricks around that, which I'll come on to in a sec. So, in terms of your slide colours and backgrounds, as a rule, high contrast, nice pastel colours tend to work, okay? Actually, interestingly, black and white is probably a bad combination. Black and white you'd think would be the ultimate high contrast combination. Black and white actually tends to put people off quite a bit. and again, the psychologists probably have an explanation for it, but black and white tends to be a little bit too austere. So any kind of high contrast combination, as long as it is clear from a slide point of view, is likely to actually win you some votes, okay? So, interestingly, when I gave a similar talk a few years ago to the science students, and I said, look, okay, this is how we recommend, you think about your colour schemes, and I only put up one suggested colour scheme, and it was a sort of a dark blue text on a light pastel blue background. And then when the students did their presentations, there were 50 dark blue texts on a light blue background. Okay, so I'm not being prescriptive here, but what you're trying to do is show a little bit of your individuality and a little bit of your creativity. So you don't want everybody's looking the same, but you do need to think about what is going to be clear for the audience, because the clearer it is for the audience, the better they're actually going to understand and digest the information. And remember, the information might be quite technically challenging, might be quite complex. If you're talking to me as a pharmacologist about a topic in psychology, then I'm going to need to have my hand held a little bit, even though I'm a biomedical scientist, because it might not be my subject area. Okay? And part of that holding my hand is to make sure everything is clearly presented. So if you're presenting graphs, for example, what you need to make sure is that you don't have too many graphs up on the screen. And again, a big criticism I see in a lot of data is that you might have done loads of experiments, they've all yielded fantastic data, and you think, I want to show all of this. Rein yourself in, okay? Rein yourself in and think and discuss with your project supervisor, discuss with the other researchers, what is the most important graph to actually show in my 10-minute slot, because I can't show it all, okay? So that's part of the editing process. So when you show a graph, you need to make sure that, again, it is clearly labelled and clearly annotated for your audience. So whatever you show in terms of a graph should be big enough that the audience can see at a glance what the trend is. And then you spend the 2 minutes or whatever, however much time you've got it up on the screen, describing the experiment that actually led to these results. And in fact, what you need to do with particularly graphical evidence is be able to draw the audience's attention to perhaps a key result or key experiment that led to this graph. So if you're looking at this trend, then obviously the audience is going to be thinking about, okay, well, what happened here? So you may specifically want to draw their attention to something and actually say, okay, well, this is a particular variable that happened when we were doing this particular experiment. And again, you flesh out the details. So you don't necessarily have to have all the gory details up on the screen that leads to an overwhelming figure, but you can certainly talk about something of particular interest, particularly if it's eye-catching enough for the audience to think, what went on there? So you can actually preempt them asking you a question about, why were the error bars so big on that particular data point? You can actually diffuse that question by actually answering it beforehand. Okay, so golden rule with graphs is make sure they're big enough to be seen, and make sure you don't overwhelm the audience with too much information, and certainly you hold their hand with explaining the rationale, the experimental methodology that led to this particular result. Okay? So graphs, they're quite tricky. Graphs are a difficult one. I think of all the kinds of data that you can present, graphs are the ones that can potentially be the things that are the most difficult to explain away. Okay? And I'll come on to how you can potentially diffuse that in a moment. But I'm not saying you should shy away from showing graphs, but you do need to be quite careful with graphs in making sure that your audience understands what the graph actually means. Okay, so you've got to walk, you've got to hold their hand. Similarly with tables, with tabular data. Tabular data, the problem with tabular data is that even if you show only one table of data, there tends to be, because of the very nature of tables, a lot of information for the audience to have to read. So if they're looking at a table of data, they're going to have to go through all of this. What were the treatments? What were the detections? What were the variables here? So there's quite a lot of information they are going to have to read. So again, you need to help them by perhaps highlighting only the specific results that they need to be looking at. Okay? So again, you need to be quite draconian with what kind of tabular data you're showing. Make sure any tables are meaningful tables that can be explained clearly and are up on the screen long enough for the audience to actually understand, because it will take them a little bit more time to look through and analyse themselves a table versus something that's slightly more graphical, graphics-wise, than a graph. Graphs are a little bit easier to interpret, as long as you hold their hand, than having to wade through tabular data, okay? And what I tend to do if I'm presenting tables is to say, okay, well, this is the headline, these are the headline figures, and you talk about the headline figures, and again, the experiment that led to those headline figures. So discussing the significant results, the significant research. So really, when we're talking about complicated medical and scientific processes, one of the things that can be of a huge, huge help are animations and graphics. And you don't have to be a world-class artist to do a good, informative and educational graphic, okay? And by that I also include animations, because PowerPoint now is very good at allowing you to do animations. So why can animations help? Well, typically, whether people admit it or not, most people tend to be visual learners, okay? So in an audience, typically, you may have 75% of the audience being visual learners. That means that they best understand concepts if it is presented to them in a visual way. And this is quite a useful way of deconstructing and decomplicating graphs and tables. You may well want to show a graph or show a table, but you may then want to back it up a little bit by having your interpretation of what that result means. Okay, so you might have a graph of data and you say, well, this is actually what's happening from a mechanistic point of view. And the way that animations can help is that they can take a really quite complicated scientific process or medical process, and you can break it up into something that you provide a voiceover to. So this, for example, was, or is, a slide that I talk to the students about in terms of DNA replication. And it takes me quite a long time to talk to them about replication, but it means that with this animation I can highlight particular enzymes involved in the DNA replication process. I can talk about the different strands of DNA and what the fragments are actually doing and how they're stitched together. And it allows me to sort of use the animation as a means of demystifying and uncomplicating quite a lengthy and laborious process, and it's very difficult, or quite difficult, to talk an audience through a complicated process. Say you've been doing some experiments and research, and you've come up with a research hypothesis that you want to actually present. If you can, and not all research lends itself to a graphical, a diagrammatic interpretation, but if you can, it can help for the simple reason. And I'll give you an example here. This week, I was teaching the final year pharmacology students and our final year intercalating pharmacology students about the malaria parasite, Plasmodium falciparum, and I was talking about drug resistance. I was talking about chloroquine resistance in Plasmodium, and why it's such a problem. So, you know, you've got a really good anti-malarial drug, but of course, if the protozoa of Plasmodium are resistant to chloroquine, then you can give the patient as much chloroquine as you like and they're still going to suffer from malaria. And I was explaining the mechanism of action by which the Plasmodium can become resistant to chloroquine. And I didn't have time to do an animation, because these kind of animations, although they're quite blocky, there's no kind of art here, it's just that there's sort of squares and circles and this kind of stuff. It does take time. And I didn't have time to put a graphic together, an animation, of how Plasmodium falciparum becomes resistant to chloroquine. So I had to explain it to the audience verbally, okay? And I had the audience, about 25 students, and I was explaining how the chloroquine gets accumulated in the Plasmodium food vacuole, and there's a drug transporter in the cell membrane between the food vacuole and the cytosol, and the transporter, if it mutates, can enhance the output of chloroquine, and therefore if you enhance the output of chloroquine out of the food vacuole, that means the bug, the Plasmodium, becomes resistant to it. Now, the explanation I gave was correct, but I was looking at the audience now thinking, what's going on there? What transport? What? And it would have been far easier to explain that mechanism of action within a graphical context, within a schematic context. Now, as I said, the caveat is there are some aspects of medical research that don't lend themselves necessarily to a more diagrammatic format. But if you can find a little diagrammatic way of introducing that, your audience will actually thank you for it, because whether they admit it or not, most people are visual learners. They'd rather have something they can see as a process than have something explained to them. Or worse, have an absolute bucket load of text up on screen. Now, any of you first years, after the Easter break, will be having my practical session, clinical demonstration on clinical trials and use of the pharmacoscope, and we do an experiment. We do an afternoon's clinical trial on drugs on ice and the effects of drugs on ice. And we have to describe the target system. And the problem with describing it, either, as I said, orally or having a load of text up on screen, is look at this. You know, if you're reading this about how the iris muscles in the eye constrict or dilate in response to ambient light levels, everything that's written here is absolutely correct. But as an audience, you don't want to read all that. That's just too much text. Okay? That's just like a massive Kindle. You don't want to read that. So it doesn't matter how correct that description is, whether it's in text format on the screen or whether I'm explaining to you orally. Actually, it makes more sense to take this concept of this. Okay, so you're doing your rough notes, you're thinking, okay, well, I want to describe how the pupil changes shape in response to light. So what am I going to have to actually get the audience on board with? Okay, well, there are going to have to be some basic elements of the eye, basic anatomy of the eye. Then we need to talk about the processes that lead to dilation of the eye. Then we need to think about the converse, the processes that lead to constriction. So these are all the rough elements that go towards the finished product. And this is the kind of thing that you'll be putting together as you are populating the talk. So you may think, okay, I've got this bit of data from my experiments, from my research, and it's showing blah-de-blah. How can I show blah-de-blah in terms of perhaps an animation, perhaps a sequential step animation? And the reason that animations and graphics can be your friend is it allows you to put a lot of information on a slide, but introduce it stepwise. So you're not all just going on the screen at the same time where it's overwhelming the audience, but you can introduce those concepts sequentially. So when I was storyboarding how to show this particular concept, these were exactly the processes I went through. I went through 3 or 4 static images jotted on a rough piece of paper. And bear in mind, like I said, I'm not an artist. And all I was doing with the storyboarding process is thinking, okay, if I was trying to explain this in an animated way, in a graphical way, what would I be wanting to see as an audience? Okay, what would I want to be seen on the screen? So the storyboarding process literally can be the difference between a good presentation and a great presentation. So after I'd done the storyboarding process, I ended up with this. And this has helped me explain how the iris muscles, the groups of iris muscles, actually cause the change in pupil size in response to light. So this is technically one slide, but there's an awful lot of stuff that I can introduce in a sequential way. If it's up on the screen for 2 minutes, I've got plenty of time to talk about it. Okay, so technically, although this is one slide, it's quite a bit of information. First of all, I set the scene by describing the basic structures, the iris dilator, the iris constrictor, and then I talk about the levels of innervation to each of those muscle groups in response to light. And what tends to keep the audience awake is if there's something for them to look at. So if I am talking about parasympathetic innervation of the constrictor muscle in response to increasing light, then I can show them that in an animated way. So that text description of how parasympathetic innervation causes the constriction that I gave here is completely, right? There's nothing wrong with that description. But if you compare the way that that looks, or hearing you talk about it compared to this. This is a more appealing way to show that mechanism. And so that's the challenge, or one of the challenges with a research talk, is that you may have spent a lot of time in the lab, you've got a lot of time in the field collecting data, and then you need to think of a way to present that data in a way that's palatable and digestible to the audience. Now, as I said, I'll put my hand up. These kind of graphical approaches lend themselves quite well to laboratory-based research. A little bit more of a challenge to find the equivalent for perhaps social medicine. Okay? But if you can find a way in to do graphics, if you can find a way in to do animation, explain the numerical and text data that you're actually showing, the audience love it. Okay? Because it gives them something to look at. And from a selfish point of view, if you've got things that are moving on screen, then it does tend to keep your audience awake a little bit. Proof of the pudding, I guess, of the first years is whether you fall asleep in this practical class after the research, I guess. But it can help, okay? Now, how do you come up with these animations? Or how do you come up with these graphics in general? Well, the good news is that PowerPoint is phenomenal these days, okay? And most students use PowerPoint incredibly effectively. In fact, most researchers use PowerPoint. I don't know any researchers that don't use PowerPoint, okay? I'll be honest with you. At the moment, I'm the only person that uses Adobe Flash for presentations, okay? I don't use PowerPoint. I have a problem with PowerPoint because I like to do some interactive stuff with some of the presentations I do, and for that, PowerPoint doesn't give me the flexibility that I need. But I would certainly recommend that PowerPoint is the weapon of choice for you in terms of putting your presentations together. It allows you to do all that kind of basic animation stuff of the blocky diagrams, showing DNA replication. That's perfect. PowerPoint will allow you to do that. And it will allow you to introduce these concepts in a graphical way, and introduce it in an animated way. It does all the hard work for you in terms of the animation. Now that said, if you do fancy doing something a little bit more eye-catching, a little bit more engaging for the audience, there are plenty of other software packages out there. And the good news is a lot of these are actually free for students. Okay, I have to pay top dollar for them because I've got a job, but students can actually have access to these things for free, certainly at hugely discounted prices. So I use a program called Adobe Flash, certainly for my 2D animations. So that thing like that DNA replication, that was all done in Adobe Flash, and actually it was quite simple to put together because there's no art involved in it. If I want something a little bit more three-dimensional, a little bit more engaging, then there are plenty of things out there. DAZ 3D Poser, that's free, that's completely free, and that has the anatomically correct mannequins and anatomical structures that you can download and use for three-dimensional imaging. And if you are really keen, this is free as well. Autodesk Maya. Autodesk Maya is the stuff that Industrial Light and Magic use, the stuff that Weta use. All the kind of big special effects movies, they use Autodesk Maya. Okay, I've just started to learn how to use Autodesk Maya, and it's a bit of a brain fry. DAZ 3D is pretty easy to actually get hold of. Adobe Flash is quite easy to use as well. So, if you want to show the title, absolutely knock yourself out. There's plenty of stuff out there. It's got a steep learning curve, but it's not beyond, certainly not beyond medical students. But weapon of choice, PowerPoint. PowerPoint will allow you to do whatever you need to do very effectively and do it. The interesting thing is PowerPoint is very quick to use. Most of you probably have to play around with PowerPoint at this stage. I know certainly if anybody past first year will have done it. Now, PowerPoint is certainly one to recommend. But do feel free to have a look at these programs too. So, when we're talking about animations, video clips, very often it can add a real enhancement to your presentation. If you've got a nice video clip of a patient and they've given their permission for it, perhaps you want to show an interview you've done with that patient, or you want to show an animation or a video clip of some experiment you've done, fantastic. But these kind of venues can be a curse or a blessing. And I'll give you the apocryphal tale from me, and And when I went to this conference in Orlando a few years ago, I was presenting my cardiovascular research on hydroperoxyicodefentric acid, and I was working on platelets. I was looking at platelet function post-MI, I was looking at in-stent restenosis, all kinds of things where we have aberrant platelet responses, and it really lended itself, my data lended itself very well to lots of fancy animations about how thrombus falls, or thrombi fall. So I spent probably about 2 months before the actual presentation putting a lot of very complicated, well not complicated, a lot of lengthy animations together that explained my data. And I have to say so myself, it was pretty good. And of course I phoned up or went to the place and I said, look, you know, we have to run these animations. Yeah, no problem, we have to run these animations. Bear in mind, this was in the days when people didn't tend to put a lot of animated or video content in their presentations. They swore blind to me, International Conference Centre in Orlando, yeah, I'll be able to play it. So of course I pitch up there, international audience, put my presentation on, and that came up. Unrecognised video, nothing would play. Okay, and that was it, that was my talk over. So a year's worth of research, 2 months worth of putting the presentation together, and that's what happened. And if you ever want dictionary definition of gutted, that's pretty much what happened to me. And there was some quite blue expletives mentioned when I realised that I couldn't run it. And I fell into the trap of believing the venue, and they said, yeah, it will run fine. So I didn't bring my own laptop. It would have run on my own laptop, but I didn't bother bringing it. I just brought it in a memory stick, loaded it up, and that was it. So I then had to spend 20 minutes explaining my data orally, and that was a nightmare. So my top tip is wherever you end up giving a talk, in whatever facilities, A, you scope out the venue first to see what kind of arena that you will be giving a presentation in. Secondly, you check the tech, you check the hardware. Little things like, will your iPad connect to the lectern? Will their PC run whatever you've created on your Mac? Or vice versa. So I'm really anal about this these days. I bring everything with me, okay? I've even got my own projector. And in fact, if that projector hadn't come on tonight, I was going to go back to my lab and pick up my portable projector and bring it back in here and so we could project it on the wall. Okay? I have been burnt too many times by tech failing on it. Okay? So it is a big deal because there is nothing more crushing than putting together a really good talk in whatever format and then for whatever reason not playing. Okay? That can really destroy. Okay? So make sure you always bring something that will allow you to play it on your own computer. And with that in mind, bear in mind, whatever you create on your own computer, your computer's colour resolution will not be the same as the colour resolution coming out of the projector. So again, if you can, it's worth checking that the beautiful colour scheme that you've done on your own computer does actually map to what the projector's going to do. And it doesn't come out in a really gaudy, horrible colour that the people are going to hate. Okay? But always check out the tech in the venue, make sure that all the hard work that you've done in putting the presentation together is going to pay off. Now, one thing that is a common element to pretty much all research talks is once you've done your talk, you're going to get questions. Now the good news, as I said, is from a research perspective, when you give your talk to a research audience, they don't have the knives out. Okay? We've all been in the same boat in terms of making research presentations, and really one of the reasons we give research presentations is to get feedback, is to get criticism. And I can count on one hand the number of times I'm off topic. And you know what? You get pretty angry about it. You think, I just spent 10 minutes explaining this to you and you're asking a really stupid question. And the students, medics get stroppy, they get defensive about it. And that's a road loser, okay? There are diplomatic ways of dealing with people who perhaps either haven't understood or perhaps have just been asleep and decided to just wade in with a pointless question. Never get stroppy, never get defensive. I've seen it a few times, and it's a spoiling factor because you think, you've done a really good talk, and then you just throw it away by getting stroppy and defensive and angry at the end of it. And I know why people get angry. I've been on the receiving end of it too, and you do feel, you think, well, why do you ask that? That's a stupid question. But you've got to behave diplomatically. Typically, the most diplomatic way of dealing with it is to say, well, that's a very interesting point that you've raised, and I should clearly try that experiment when I get back to the lab. And it's a polite way of saying you don't actually have the answer to what they specifically asked you. So you can diplomatically diffuse the situation. You can deal with it professionally. Because if you get stroppy or defensive, that can, again, that facade of professionalism can drop, and you waste all that good feeling that you've got from the previous talk, all that hard work that you put into the talk can be gone in a second if you come across as stroppy and defensive. So you never pretend that you know the answer. Never try and fob somebody off with a made-up answer. You can speculate, and you can say, well, I'm not quite sure, but potentially the mechanism would be, and you can speculate and hypothesize so much you like, that's fine, but never try and sort of come across as, right, this is the answer, when you know, in fact, you don't really have a clue what's going on. So you have to be careful with the way that you handle questions. And as I said, the good news is that the questions on the whole you'll get will be very helpful, very constructive. Nobody's out to get you, okay? And the only time that people give you a hard time in questions is if you have done something in your talk that has come across as being superficial or cocky or arrogant, or something where you think, well, I'm going to take this guy down a peg or two because he's just coming here and said he's got a cure for cancer. We had a student a few years ago, 7 or 8 years ago now, who did an undergraduate talk on a research project they're doing, and they were doing an SSC project. And they came in, and literally, in 10 minutes, he was saying that what he was working on was going to be the next cure for cancer. Literally, it was that kind of, and everyone in the audience was going, and I was sitting amongst a lot of oncologists as well, and they were going, really, really, and he was just hell for leather, 10 minutes, yeah, this is going to be great, we're going to bring, yeah, it's going to cure this, it's going to do that, and he got torn apart. He got torn apart in questions because his mouth was writing checks that his brain really couldn't cash, and he got quite a drubbing in the questions. But the vast majority of people that are going to ask you questions are asking constructive questions. And it's okay not to know the right answer. It's okay to say, actually, I really don't know the answer to that, or yeah, that's an experiment I should do, or it's a very good point, you can try and speculate, but don't try and fob them off with a lie, don't try and get stroppy defensive, because all that hard work can then evaporate in a second. And I've seen medical students storm off stage. I've seen them get so wound up that a question has been asked. Even I've been in the audience thinking, wow, that guy's asked a really stupid question. But there are ways to deal with that. Okay? And you deal with it professionally because you are medics, okay? Because you're doctors. And I remember there was a yardstick. Our old head of department, who was a cardiovascular pharmacologist, and the yardstick for working out whether a student presentation had been any good or not was that he always asked a question at the end. Okay, it was part of his job as being the head of department. And you knew from the type of question he asked whether he had understood the talk or not. And if he asked the presenter a question based on their data, he understood the talk, no problem. But his default question, if he hadn't understood the talk, or had more likely fallen asleep through the talk because the talk was so bad, was that he would say, okay, tell me how digoxin works. Okay, even if the talk was on anti-cancer therapy, if he didn't get the talk, he would just say, okay, tell me how digoxin works. And you knew instantly whether your talk would work, because if you got the digoxin question, no one was down. You didn't have the X factor. If he asked you about your data, it was a peach. Okay, so there are ways and means of handling questions. So what are the tips for success? Practice. Practice, practice, practice. You need to practice on your own. You need to practice in front of your colleagues. You need to actually build your confidence with giving talks by doing as many as possible. And that can be to your colleagues. It doesn't actually have to be within the context of timetabled activities within the medical school, what have you. So any opportunity you get to actually give presentations, then the more you do, the better you'll become at. As I said, from bitter personal experience, check out the venue facilities. In fact, it's a good opportunity to have a play around with making presentations in different arenas, okay? Large lecture theatres, small seminar rooms. The more variation that you have experience of, the more confident you'll become when you actually do your presentations. So make sure the facilities will actually run whatever you put the hard work into. Don't clutter your slides. Make them less. Less is more is the philosophy here. And remember, you can talk about the stuff that actually isn't up on the screen. You can hold the hand of the audience by talking about stuff. Keep your fonts large, keep your colours high contrast, and keep any of the diagrams, or in fact your animations, simple. Okay, simple so the audience can understand really quite complicated scientific concept. And if you speak clearly and confidently, job done. Okay. So, good luck with your talks that you have to do in the future, both here and abroad. Any kind of burning questions that you have about making presentations in general? Yep.
Before I make my two very quick questions, I'd like to say probably this talk should be introduced in the curriculum in the first year and be given to every student before every other lecture. First lecture of the year. Okay, thank you.
Well, you could do me a favour with that and actually ask Professor Bly and Professor Morgan and Dr Riley, who is heading up the phase 1 of the new curriculum. I'm more than happy to do this if you think it would be of help to you as students.
We've got a meeting with Professor Morgan tomorrow.
It's entirely up to you. I'm more than happy. What I tend to do is whatever the students want, I'll make it happen. But it helps that the medical school management or medical school tend to listen to you more than listen to me. If you genuinely think that would help and wasn't too over the top, I'm more than happy to, if they want to fit it into the curriculum. Yeah, absolutely. Was this helpful, I guess, was the answer?
Yeah, very good.
Yeah. Okay. Any other questions?
Well, I haven't made my question.
Oh, sorry.
First one is, if we take the different phases of the research, background, aims, methods, etc., is there any ideal method of splitting them into 5 content slides that you would recommend?
I think it is very, very important to set the scene with your first 1 or 2 slides, and typically for your first 1 or 2 slides that can be the research topic area, and the second slide can be the key methodologies, okay? Because I think they tend to be the hardest sell for an audience in terms of you will have a diverse mixture of people, but they will not necessarily be subject experts on whatever you're specifically looking at. So if you set the scene with this is the target system, this is the topic area rather, the target of the talk, and this is the methodologies we've used, because very often the people they may be very happy to assimilate the result in the data from your research, but they might not be familiar with the background and the methodologies, particularly the methodologies, and particularly if you're talking about quite technical methodologies. And there are some caveats to that in terms of if it is a technique that is historically and widely used and people are going to be familiar with it. So, I don't know, let's take an extreme example. Blood pressure measurement, all right? Sphygmomanometer, everyone knows how to take blood pressure. So you wouldn't necessarily go to town describing how you take the blood pressure, either with a sphig or with a digital, whatever, because people think, yeah, okay, I know what systolic over diastolic means, okay? So again, that comes down to pitching to your audience. However, if there was a technique that perhaps you were only doing as a research group in this university and not many other people were, it might be worth it spending a little bit of time bringing people up to speed. So a couple of years ago when we had the PET scanner installed, in fact I give a lecture to our students on positron emission tomography because people have heard of a PET scanner, but a lot of people don't know how the PET scanner works from a quantum physics point of view. So it's worth, if there is a particularly unique technique or method that you're using, yeah, spend a little bit of time bringing the audience up to say, okay, well the data that we're going to discuss and you're going to discuss is based on this technique that you might not be familiar with. So First 2 slides, certainly, introduction methods. The rest of it can potentially be results and analysis and take-home message.
Okay, and my other question, if I may. Would you think it would be unprofessional if we finished off with a cartoon image relevant, always relevant to the subject?
Yeah, it's an interesting point actually. It's reminding me to say something. Jokes as a whole go down like a ton of lead in research talks. Now that said, finishing with a cartoon that is non-offensive, related to the topic, yeah, that's perfectly acceptable. You won't get many laughs. All right, it's just the nature of the audience, okay? And and I say this having tried pretty much everything over the years. You might have a great joke that you want to slip in. You might have a great image. You might have this, that, and the other, and you might want to sort of finish on a high. It's a tricky one. Over the years, I've come to the conclusion that it's better to be conversational with the audience and actually get them on side from a conversational point of view than try and win them over with a joke or a funny or a cartoon. Now that said, there might be an absolutely fantastic thing that will nail it for you that, yeah, put it in. That's a judgment call on your part. I do know that in the past there have been some slides that, some comic slides that were put up. Years ago, I went to in Taiwan, and the group of researchers I went with them brought their research talks with them, and they had one of them had a very... Anything else?
What's your position on referencing and citations? So regarding the background, if you just cite something, would you put that at the bottom of the page?
There's 2 ways to look at it. I take the view that if you put the citation on the slide itself, where the data is, it can actually clutter the slide. What I tend to do is my final slide can either be, it can be a combination of acknowledgements and my bibliography. So typically, if you've got, I don't know, a 10-minute presentation, you've got 5 slides, you're not going to have buckets and buckets and buckets of citations. I just find that the more text you have on a data slide, even if it's a web link or a citation, it can, again, de-emphasize the focus. So if you put it on the end slide and say, thank you very much, acknowledge my supervisor, and here are my bibliography. Last slide, job done. Anything else?
Just out of interest, how long, I know it varies, but on average, how long does it normally take you to prepare for your talks like research talks?
If I'm doing extensive animations, so if I'm doing 2-dimensional animations, 2-dimensional graphics, and I'm doing, say, a 50-minute lecture to students, plus I'm doing the background to actually put the stuff in, it would take me a month of evenings and weekends. Okay, so of course I've got the day job, so I'm doing this evenings and weekends. So a month of evenings and weekends. If I'm doing, I'll show you that animation process there. Although it's actually not showing much, it's showing increasing light, causing pupil constriction, not much going on there. The various elements you have to storyboard and stage there, that animation itself, on its own, took a week. Okay, so it's a trade-off in terms of sometimes you might not have enough time to do the fancy graphics. Okay, and that's a function of when your supervisor says when the talk is going to be and where you're going to be sending this, that, and the other. The more time you've got, obviously, the more time you can put into tarting it up with some pretty pictures and some graphics. But if you want to do the kind of animated approach, or what they do add some time onto your population time. When I talk about population time, it's how long it takes you to actually put your presentation together. Because as I said, it's a split between wading through your data, your experimental data, and editing what you want to put up on the screen and making the presentation, versus presenting it in a stylish way that engages with the audience and actually is understandable, etc., etc. So it's a bit of a balancing game. The longest one ever took me, which one am I talking about? I was doing some consultancy work for a drugs company, and I had to explain how the drug that they were selling to the cardiologists was working, and that took me 9 months. to do 1 hour's worth of animated content, but it was all animated, and it was all three-dimensional animation. Okay, so the good news is that a lot of the 3D stuff, A, is free from a software point of view, and actually, although it's a steep learning curve, it's not beyond anybody in this room. Okay, I'm not an artist. Okay, I'm not. I'm a scientist, a medical scientist, but you can pick this stuff up quite easily. Certainly, the basic animation elements are all in PowerPoint, and that's what I recommend to start with. This kind of stuff you can pick up quite quickly as long as you're prepared to put in the kind of evenings and weekends. And it's literally a function of how much time you've got and how much time you want to put into it. It's not necessarily a huge artistic endeavour, so if you sit there thinking I'm not artistic at all, well, nor am I, but you can still come up with these kind of images and these kind of storyboarding process. The trick is storyboarding. It's not the graphics, if you like, it's the storyboarding. How am I going to explain how parasympathetic innervations cause that muscle to contract and change in response to the light source? So that, as long as you get the storyboarding nailed, actually the animation bit's quite easy. As long as the facilities will play the video for you. Anything else? Stunned silence. Was this about the right level for you? Was it helpful for you? Okay, because it is a big deal giving presentations. It is something that you will do more of, certainly as you progress through our course, and certainly do more of as you enter practice and become practicing doctors. It's an intrinsic part of being a doctor, doing a period of research, but what you want to do is make sure that if you've gone to the trouble of doing the research, you don't want to blow it all by doing a lazy presentation. Okay? If you've done a year's worth of grinding research in the laboratory or grinding research in the field, you want to make sure that what's up on screen actually shows off your talent, shows off your expertise, and shows off your enthusiasm. Okay? There's a lot of body language, a lot of psychology. But if you think this would help, if you think this would be helpful for medical students from day one, then yeah, I'm more than happy to do it. But if you can have that conversation with Professor Bly and Professor Morgan, that would be great.